wake up to the sound of screaming. Again. Not your own this time, which is honestly an improvement. It's someone else's turn to find out that in this century, pain relief means a stick to bite on and a prayer you haven't pissed off God lately. The smell hits you next. A heady mix of sweat, rot, and something metallic that could only be blood or the stew you forgot on the fire last night. Welcome to the life of a medieval bone setter, the person people come to when they've fallen off a horse, or more likely, been stabbed in a tavern brawl. Your tools? A few sticks, dirty rags, a bucket of wine, and whatever hope's left in your patient's eyes. Sterilization won't be invented for another half a millennium. Antibiotics? Not even a concept. Anesthesia? Sure, if you count passing out as a medical technique. You snap bones back into place while people scream for their mothers. Sometimes they live. Sometimes they die. And when they die, people don't say, medicine failed. They say, you angered the spirits. So yeah, it sucked. But hey, if you're gonna suffer through it, you might as well know why. Before we dive elbow deep into the grimy reality of medieval healthcare, do yourself a favor. Hit that like button so the algorithm doesn't leave this poor bone setter to rot in obscurity. Subscribe if you want more horrifyingly educational history lessons. Now, let's break some bones. You don't choose to be a bone setter. You end up one. Usually because you're poor, unlucky, or both. You're born somewhere money, maybe in a village with 2 pigs and a well that smells vaguely like death. Childhood isn't about toys, it's about survival. If you make it past the age of 5, congratulations, you're already statistically impressive. Your parents are peasants, maybe serfs. They don't own you, exactly, but neither do they own much else. Your father spends his life breaking his back in the fields. Your mother spends hers breaking bread that tastes like sadness. One day, she twists her ankle in the fields, and you watch a local healer reset it by yanking it until it cracks. She screams, he grins, and you can't look away. It's horrifying, but fascinating. You see something most people in your time never do cause and effect. The ankle heals. Sort of. She limps forever, but she doesn't die. That's what passes for a miracle. As a kid, your toys are bones. Literally, you find animal skeletons behind the butchers, fascinated by how they fit together. You don't know it yet, but this obsession will shape your life and curse it. Because when the local wise woman notices your steady hands and morbid curiosity, she takes you on as her assistant. That sounds noble, right? It's not. It means grinding herbs until your arms ache, fetching water, and occasionally holding someone down while she saws off a finger. And when she dies, probably from the same infections she couldn't cure, people start coming to you. Set my arm, boy. Fix my leg. You're 15. You've never been trained. But you've got the look of someone who knows bones. And that's enough for medieval people. And just like that, your future is sealed tighter than a playhouse door. Let's be clear. Medieval medical education was less about science and more about surviving your mentors. You don't attend a university. Those are for rich men studying how many angels can dance on a dislocated kneecap. You learn through apprenticeship, trial, and a lot of error. Mostly error. Your teacher, if you're lucky enough to have one, is probably a barber surgeon. He cuts hair, drains blood, pulls teeth, and once in a while, resets bones between hangovers. His lessons are simple. Feel for the break. Don't throw up. Don't die of infection. Next. You practice on drunks first. They're ideal patients, unconscious, pliable, and unlikely to complain. You learn that bones feel warm when they're freshly broken, that flesh tears easier than you think, and that sometimes you can hear the body giving up. You pick up the medical theories of the time. The 4 humors: blood, phlegm, yellow bile, black bile. If a patient's leg is bent like a pretzel, clearly their humors are unbalanced. The solution? Probably leeches. It's always leeches, but while others cling to superstition, you start noticing patterns. You see how splints help bones heal straight. You see how wounds fester less when washed with wine. You're on the verge of scientific discovery, centuries too early to be appreciated for it. Your reputation grows, but so does resentment. Local priests whisper that you're meddling in divine territory. Healing is God's job, not yours. But they still come crawling when their legs break. Funny how faith works. Then comes your first real test. A noble's son falls off his horse. Compound fracture. Blood everywhere. Everyone's watching you, the poor peasant bone man. You set the bone perfectly. He lives. The Lord pays you in silver, a week's worth of food, and the kind of attention you really don't want. Because in the Middle Ages, competence is dangerous. Your big moment arrives, and it's drenched in blood. There's a war on. When isn't there? You're dragged to the battlefield to aid the wounded. You imagine tending to heroes. Instead, you find heaps of mangled bodies, screaming men with arms hanging like ribbons, and enough stench to haunt your dreams forever. You set bones until your fingers blister. You learn speed. The difference between saving a limb and losing one is minutes. Sometimes seconds. There's no anesthesia, no clean instruments, no rest. You develop rituals. You drink before you start. You drink after you stop. And sometimes you drink during. It's the only way to silence the screams.
Don't let me die.
One day, your patient is a young soldier begging you to save his leg. The break is bad, jagged, blackened, crawling with flies. You know what you have to do. Amputate. But he's awake. He looks at you with eyes that already know what's coming. You pick up the saw. Afterward, you vomit behind a tent and stare at your bloody hands. You saved his life, maybe, but something inside you cracked with that bone. That's when you understand, in this era, healing and hurting are the same profession. When the war ends, you're praised as a miracle worker. They give you a medal. It's just polished brass, but people bow when you pass. Yet every night, the screams return. One day, a mother brings her son to you, another broken leg, another plea. You hesitate. You smell the battlefield again. Your hands shake. You set the bone anyway. But this time, it heals wrong. The boy limps for life. His mother curses you. That's when you realize something worse than failure. No matter how many bones you mend, people remember the ones you break. Years pass. Your hands grow crooked. Ironic, isn't it? The bone setter with fingers twisted from arthritis. Every crack you fixed came with a price. And now, your body's the ledger. Your fame fades into infamy. People whisper about your cursed touch. They forget the hundreds you helped, remember the few you couldn't. Rumor spreads faster than the plague, and twice as deadly. You drink more. Not for celebration, but survival. Your dreams are crowded faces of the dying, screams that never fade. Medicine begins to evolve, slowly. Barber surgeons become surgeons. Scholars write about blood circulation. Real science creeps into the world, and you, the hands-on healer, are suddenly a relic. Worse, your methods are outlawed. The same splints you invented? Stolen. The same techniques you refined? Published under a nobleman's name. You watch as the future of medicine leaves you behind, limping. In your village, people still come for help, but they don't look you in the eye anymore. You fix their bones. They cross themselves after. You've become a necessary evil. Sometimes, you wonder if God ever forgave you for trying to do his job. Sometimes, you think maybe he never noticed. Then, one winter night, someone knocks on your door. A plague doctor mask, cloak, the whole terrifying ensemble. He needs your help. Even now, they still come crawling when their bones snap. Some things never change. Your final test isn't on a battlefield, it's in your own home. You wake to find your apprentice a girl. Brave, clever, eager, standing over a patient. He's dying. The leg's black, gangrenous. You can tell from across the room. You know what to do. You've done it 1,000 times. But your hands won't move. You've seen too much, lost too much. You freeze. She looks at you terrified, desperate.
Cut.
Master, what do I do? You swallow the last of your pride.
Cut.
Cut. She does.
Very good.
Clean,
Maintain
fast,
that pace,
confident.
but remember, the veins
You guide her
must be
words,
discarded.
but not her
They carry
hands.
the bitterness.
For once, someone else carries the weight. The patient lives. Barely. But the girl? She's changed. The look in her eyes, that same haunted gleam you've carried your whole life. You've passed on more than skill. You've passed on the curse. Years later, you die quietly. No plague, no violence. Just worn out from carrying too many bones and too many ghosts. No one writes your name in the history books. But every time a surgeon sets a bone, every time someone heals a fracture without infection, a small, invisible piece of you lives on. Because you were never a monster. Just a human doing the impossible before humanity was ready. And if that's not the definition of it sucked, nothing is. If you survive this little medieval nightmare, you probably owe yourself a deep breath and maybe a tetanus shot. Hit like if your bones are still intact, and subscribe for more dark dives into history's most cursed professions. Because in the past, pain was temporary, but storytelling? That's permanent.